Americans don't even get affordable health care right now. What the makes you think immigrants do? They're not trying to take away health care for immigrants. They're trying to take away health care for you.
I'm making this video because I just wanted to be able to try to tell followers of MAGA that you're being lied to. This government shutdown is not about trying to give health care to undocumented people. Medicaid is only available to citizens in the first place, so you need to have a social security number, which only citizens can get. So when Democrats are talking about trying to not get people kicked off Medicaid, there's nothing to do with anything with undocumented people because they weren't on Medicaid in the first place. So you're being lied to. The Wall Street Journal even called out Speaker Johnson, President Trump, J.D. Vance, Senator John Thune for misrepresenting what this is about. And if you look at this tweet from the White House saying the Democrat Party wants open borders, transgender for everybody, men and women's sports, crime in the streets, cashless bail for more crime, they're just lying to you. Notice how these were the same things they said in the election a year ago. They were saying that immigrants, illegal immigrants only, were eating cats and dogs. They were saying that kids were coming home from school having had a sex change days later, like nobody's reporting their kid missing for a couple days. We can't even give our kids Tylenol or Advil without school permission. And somehow they're getting away with transgender operations, which costs like $50,000 anyway. Remember, they're saying that women were waiting to have babies so that they could kill their babies, and that this was legal in California. There's a 6-month limit to abortions in California. They're lying to you. They're trying to get you emotional and angry about something that isn't happening. And frankly, you deserve better. We all do. That's all.
Here's the truth. Our healthcare does not have to get more expensive. It just doesn't. This doesn't have to happen. Also, the government doesn't have to shut down. It doesn't have to happen. It's all theater. And who loses? Us. We lose. So tell your representatives, we want healthcare. It's simple.
There are two main drivers behind this Republican government shutdown, and we need to talk about both of them. Hey, it's Oliver Larkin, Democratic candidate for Florida's 23rd Congressional District, primarying Jared Moskowitz in South Florida's Broward and Palm Beach County. Reason number one, Republicans want the Affordable Care Act health insurance tax credits to expire, which could raise health insurance premiums for up to 22 million Americans and kick 4 million people off of the health insurance we currently have. In our district alone, 164,000 people could see their healthcare costs increase, and a family of four making $64,000 a year could see their healthcare premiums up by 183%. In the United States, where we are the highest income nation on earth not to guarantee healthcare is a right, and where we pay the highest per capita cost for our healthcare of any nation by far, the last thing we should be doing is kicking more people off of their health insurance and making it more unaffordable. With that being said, defending the status quo is not an option. So while we fight Republican efforts to tear healthcare away from millions of our neighbors, we must also fight for Medicare for all. Spending billions and billions and billions of taxpayer dollars subsidizing the profits of private health insurance companies is not sustainable or cost effective. We need Medicare for all, no premiums, deductibles, copays, or prior authorizations to eliminate the private health insurance industry and to rein in the for-profit hospital corporations, big pharma, and for-profit medical technologies. And I'm doing that by rejecting corporate PAC money, signing the Patients Over Profits Pledge of National Nurses United, and taking on these corrupt interests that are bankrolling Jared Moskowitz's campaign. But there's another reason why Republicans have shut down the government, and that brings us to point number two. On September 23rd, Democratic Congresswoman-elect Adelita Grijalva was elected in a special election in Arizona to be the 218th vote in Congress to sign a discharge petition that would bring that Jeffrey Epstein files to the floor for a vote to be released. This bipartisan discharge petition led by Congressman Ro Khanna of California and Thomas Massie of Kentucky is the answer to releasing the Jeffrey Epstein files. If we get Adelita Grijalva sworn in, we will have the 218th vote to bring this discharge petition to the House floor. We need to vote for it, and we need Mike Johnson to swear in Adelita Grijalva. He cannot run the clock out on this any longer. He cannot hide behind a government shutdown. It is time to give the people of Arizona the representation they voted for in Congress. No more delays. Let's end this government shutdown. Let's protect healthcare, and let's release the Epstein files. My name is Oliver Larkin. If you want to support our campaign for Congress in the Democratic primary in Florida's 23rd Congressional District against Jared Moskowitz, please visit the link in our bio, donate some money if you can, and keep this grassroots campaign going. Let's keep up the fight. I'll see you on the campaign trail.
I don't know who needs to hear this, but the biggest reason that there's a government shutdown is because the ACA, Affordable Care Act, has tax credits about to expire. Now, this wasn't a case in previous CRs, but it is the case now. So if they do nothing and just sign what it is now, like you people are saying the Democrats should just do, that means the Affordable Care Act will become increasingly more expensive for American families once those credits expire at the end of the year. Is that simple enough for you? They want a bipartisan CR, cleanly done, that doesn't include that includes some sort of extension of these tax credits. They also want to get rid of these dirty little riders that the Republicans slipped in there as well, that are non-budgetary and have nothing to do with the CR. So these couple things that need to be cleaned up for the benefit of the people in this country. Not for party lines, not to just block the Republicans, and certainly not to make government employees go without paychecks. This is not a Democrat thing. This is the Republicans being unwilling to even include Democrats in negotiations and discussions for the CR. So this is unheard of, that they don't have any kind of input whatsoever. The Republicans are trying to push through an entire Republican-only CR. Why do you think the Democrats should just roll over and sign that? They shouldn't. This is on Republicans. They own all three branches right now, so whatever happens right now is on them. They can't get enough votes for a CR because it's a bullshit plan they have put in front of Congress. That's why it's not getting signed. Share your thoughts in the comment section and follow me for more.
One of the reasons we currently have a government shutdown is Democrats have been advocating for maintaining and extending the subsidies to the premiums for those who obtain health insurance through the Affordable Care Act marketplace. There are currently 24 million people who obtain their health insurance through the ACA marketplace. Of those, 20 million of them benefit from these subsidies on their premiums. If those subsidies expire, that means 20 million people will see vast increases in the premiums for their health insurance. There are various amounts by which these premiums will change depending on a number of factors, including income level. But for those who have the lowest income, for those making less than $25,000 a year, the premium would increase by 573% if these subsidies expire. The premiums would also go up for those who were not getting those subsidies because there would then be fewer people who are going to be able to access health insurance this way. And since there will be fewer enrollees, the price for everyone who remains will go up. The Congressional Budget Office, which is a non-partisan organization, estimates about 4 million people will end up losing health insurance if these subsidies are allowed to expire, which is what the Republicans would like to do. I'll give one quick example that's easy to understand. A 60-year-old couple who makes $85,000 a year would see their premium rise over $22,000 per year if the subsidies are allowed to expire. KFF estimates on average the premiums would more than double. I'm just wondering, is this how we make America healthy again?
All right, folks, thank you so much for clicking on this video. Thank you so much for always coming back to support our channel. I always appreciate your support. Please don't forget to subscribe. All right, okay? Now, we've seen the government shutdown, and we've seen that people are concerned about their health, cost, because it is going to double and it is going to skyrocket. But the effects are not only on the Americans, but specifically on these MAGA, the Trump supporters, because they're the one also who are getting affected bigly. So I'm gonna state for you and show you how these people are gonna get affected and how Americans are concerned about the healthcare, because man, things are going out of hand. If they're going to remove the ACA or the Medicaid, People are thinking that is for the immigrants, but let me tell you, I believe there is no immigrant that have a social security number. So social security number is for the citizens. So this ACA or Obamacare is for the citizens. They're the one receiving these benefits. So it is not for the immigrants. It is for the citizens. Then we're going to see the looming expiration of Affordable Care Act, premium subsidies, because the primary concern is the expiration of enhanced premium tax credits of ACE marketplace plans, which are set to end the close of the year. We've seen the analysis of KFF, which they found that a large majority of individuals who benefit from these subsidies, 80% of all enrollees receiving tax credits, live in states won by the president. Yeah, this means a substantial portion of the voter base that supported him relies on these subsidies to afford their health care. That's true. Then they went ahead and voted against their own interest. So if Congress does not extend these subsidies, enrollees' out-of-pocket costs are projected to more than double on average, with some estimates showing an average annual increase of over 100% or $1,000 for subsidies and release. Then the failure to extend these subsidies, which was the core Democrat demand in Shutdown fight that the administration and Republican initially rejected, directly threatens the financial stability of many of these supporters. So only this part shows you that MAGA are the more or are the one that is going to suffer a lot because of this government shutdown, because of this doubling or skyrocketing of healthcare cost. So many of the regions with high concentration of the president's supporters base are rural and have greater reliance on federal health programs. Studies indicate that enrollees in rural counties are expected to see even higher out-of-pocket cost increase from the expiring subsidies compared to urban areas. This is a critical factor as rural America is a key demographic for DT's supporters. The ACE marketplace caters to low and middle income individuals as well who are self-employed groups, which includes a significant number of working class votes often counted among the DT's base. So these individuals face the prospect of their health insurance cost nearly doubling or more likely hitting their household budgets. I'm still showing you the MAGA, man, you vote against your own interest without knowing what's going to happen to your life, without knowing what's going to happen to healthcare cost. So imagine if it doubles. Many rural places who depends on this government support are going to be affected, are going to really be affected. But they also who voted this, you voted for this. You voted for this. So it's going to affect many Americans, but also you are affected. And it will get worse to you because you guys, you're the one who voted for this. Beyond the ACE subsidies, a previous pieces of Republican registration doubled the big beautiful bill includes deep long-term cuts to Medicaid, the health program for low-income and disabled Americans. So millions are going to lose coverage because the nonpartisan Congressional Budget Office project that combined effect of the laws changes, including Medicaid cuts, such as new work requirements and other programs, restriction could result in 10 million people losing health care over the next decade. 10 million people. 10 million people. Those are loads. There are lots of people. So imagine losing their health, benefits. What's going to happen? They're going to get sick. It's going to get worse in their life. It's going to be bad. It's going to be bad. This is a really good sign that shows your choices are going to affect you today or tomorrow. It may not affect you today, but tomorrow is going to affect you. which is happening right now because the MAGA is scared of losing the ACA. They lost the Medicaid. Administration have changed the way you can receive that benefits. So it is affecting them. But not only them alone, but also American at large. What we are going to see is the threat to a local healthcare infrastructure because Medicaid is a vital lifeline for rural hospitals and clinics. The prospect of funding cuts coupled with the threats of millions of people losing coverage creates a ripple effect that could destabilize local healthcare providers in the very communities that form a core of the DT's political support. Yes. So the timing of the shutdown and political stalemate over the subsidies have created an environment of panic and uncertainty just as the ACA open enrollment period is beginning. So the insurers are in the process of setting and sending out premium notice for the upcoming year due to the lack of extension from Congress. This notice must reflect the higher and subsidies rates. This means millions of Americans are receiving or soon will receive shockingly high bill estimated, creating immediate fear and confusion about their health care option for the coming year. Okay, it is going also to create the erosion of the market stability because insurers have warned that if the subsidies expire, healthier people will likely drop their coverage due to the expense, leaving a sicker pool of enrollees. This forced insurers to raise premiums further for everyone else, compounding the cost problems for those who are trying to maintain coverage. So what they will do is the growing political blame and discontent from the MAGA base, because as the electric financial pain becomes a reality, the political blame is increasingly being assigned to the president and Republican, even by some of the most conservative voices, because even strongly conservative Republican lawmakers have voiced public displeasure and disgust over the idea of health insurance premium doubling for their constituents, acknowledging the severe negative impact on working Americans, families. So folks, it is going to be a very worst year if people don't have these benefits. I'm talking about the ACA or Obamacare. It's even hard to enroll in the Medicaid, those government's assistance. All of them are hard. Then, if I remember that people who are affected right now voted for this, man, I got very sad. Because they F around. Now they find out. So imagine someone who is sick and is about to lose all the health insurance is going to double. Man, it's going to be hard. It is going to be hard for these people. It is going to be really hard. Folks, tell me, what do you think about this topic? What do you think about what's happening? What do you think about the shutdown of the government? What do you think about healthcare costs to double or skyrocket? I am a presenter Fikazo. Let's meet in the next episode. Don't forget to subscribe.